I think we're all kind of looking at the numbers with trepidation and maybe even a little bit of a sense of dread, looking at the future to see what's ahead of us still. As the numbers tick up, I think we could just kind of hope that we're going to have the fortitude to push through.
Yes, cases in Texas are going up. I'm seeing a lot more cases every day than I was seeing for the last 3 months. Diagnosed more people with COVID over the last weekend than I saw in the entire months of March and April. Most of them are young, healthy people. Most of them aren't terribly sick, but many of them still are.
A lot of people coming in are in their 20s, 30s, 40s, and a lot of them are able to go home, but the ones that aren't are very sick. We're having people who are having their hearts destroyed due to this virus.
Seeing the numbers go up and seeing some pushback from people who have quarantine fatigue and just are kind of tired of all the restrictions, and knowing how that can affect our numbers here is troublesome.
I understand that people feel like their rights are being taken away by the request to wear masks in public, to grocery stores, to pharmacies, things like that. But they don't realize that they're not immune to the virus. A lot of people that do have COVID are asymptomatic, so if they don't wear masks, they're spreading it to people who have a lot of health conditions or are vulnerable.
So I know that the fire department, police department, first responders did a parade around our hospital to support us, frontline workers. That goes a long ways. Sometimes you don't always see the results of your work, either as a chaplain or a doctor or a nurse, but we know that we're making a difference during this time, and we encourage everyone to wear those masks and to wash your hands and stay safe.
Many beaches in Florida closed this 4th of July weekend, and people who are thinking about going anyway will get a fine. NBC News correspondent Carrie Sanders joining me now from Lauderdale by the Sea, which is in Florida, of course. Carrie, I'll ask you about the beautiful beaches there in a moment, but first, the state reporting another 6,000 COVID cases today. What's the latest on the situation there?
Well, the numbers are climbing. That number today, 6,012, is the 4th highest in the state of Florida since this pandemic began. So it really puts a fine point on the fact that the numbers are still climbing. And while the Northeast may have seen a drop, it looks like it's a wave moving down now through the South and the Southwest because the numbers are going up, as opposed to what many people talk about, a second wave. This is really the first wave in the state of Florida. I'm here on the beach, okay? This is in Broward County, Lauderdale by the Sea. Folks out here today doing a good job, socially distancing, doing what they're supposed to do. But Broward County to the north of me, Palm Beach County to the south, Miami-Dade County, and all the way down into the Keys, Monroe County, have decided on July 4th, in fact, beginning on Friday, they're going to close to sort of keep people away from each other because otherwise they would be crowded. But if you look around the state, it's sort of a hodgepodge. If I take you north, say, to Jacksonville Beach here on the East Coast, the beach will be open, but they have decided to at least cancel the fireworks because they felt somewhat irresponsible, the city officials said in Jacksonville Beach, that if they had the fireworks, it would bring people out, they would all crowd together and potentially spread the Rona around to other people. And then ultimately we go up into the Panhandle in Panama City, beach is wide open. Things are going to be just the same way they are every day. And right now it's hot. I'm out here in this shirt. It's like 93 degrees. In just about every beach, it's 90-something degrees in Florida today, Allison.
Yeah, Carrie, you're very dressed for someone who's at the beach today. I know you've been speaking with people in Florida. What are they telling you about the spike, and kind of what's the reaction to what's going on there?
Well, it's really interesting. You know, some people are taking this very seriously, and they're almost shaming people that aren't wearing masks in a confrontational way. But there's a whole other group of people who are somewhat suspicious, not only suspicious of the value of a mask, but it seems to me a deep-rooted suspicion in government itself. Take a listen.
They've ramped up the testing, as you can see. Thousands of tests have been done. Are they accurate or are they inaccurate?
So you question that?
I'm questioning the accuracy of the coronavirus.
You know, people who are not from Florida have criticized, why doesn't the state have one rule for the entire state? Everybody wear a mask, as opposed to the patchwork of county and city and difference here and difference there.
Unfortunately, This is America, and we're independent, and we're democratic. We're not a communist state.
So the idea of having one rule across the state to you is
not right, because everybody's different, like our fingers, different sizes.
And of course, that's the way it works, Allison, in the state of Florida, and really much across the country, as we're seeing. And when you compare Florida, say, to South Korea, which is about twice the size in population, where they basically had one rule for the whole country, here you have a patchwork. And it may be that it takes a little bit of history, but if you look at what's going right now, it would be pretty easy to conclude, say, health officials, that the patchwork of rules only makes things more complicated. Allison?
Carrie, it's clear not everyone plans on following all of the rules there, or they're not always into wearing masks or staying at home. So what happens if someone violates this stay away from the beach order this weekend? What are the penalties?
Well, you know, it's not just stay away from the beach, it's the wearing of the masks. I think the best example is Miami Beach, because their fines are really dramatic. They start out at around $50, but they can go up to $500. That's the kind of thing that's going to make anybody look up. And ultimately, there may be one person who wants to take this to court, challenge the fine. But in the meantime, the process of going through, getting a fine, not wearing a mask, if nothing else, it's going to be a hassle to the people who choose consciously not to do it. I will say this. I travel around the state of Florida. I just got back from Central Florida. There are absolute differences. Down in South Florida, it seems to me more people are aware wearing masks. When you get up into the Panhandle, into Central Florida, there's a more relaxed attitude. And then when you get into rural Florida, there's almost a sense that why would I need to wear a mask? But underscoring that is in, well, for instance, in Lake County, Florida, extremely rural area, they just had a record number in a single day. They had 122 cases. So this is not just in those urban crushed areas as we see along the beach. And again, I got to point out, everybody's socially distanced here today.
Good to hear, good to see. And Carrie, I know you said it's hot out there. Thank you so much for being out there, wearing a mask, keeping it safe for us. We appreciate it.
Absolutely.
Bars, gyms, and other businesses in Arizona are now closed for at least the next month as the state tries to contain a major coronavirus spike. NBC News reporter Vaughn Hilliard joining me now from Phoenix. Vaughn, what are some of the new restrictions in place there?
The governor implemented these executive orders just yesterday, Allison. They include the shuttering of bars, of gymnasiums, of movie theaters, of water parks, of tubing operations. It also moved back the start date of the school year. There's a good number of schools in the state that usually start in the middle of July. That has now been pushed back to August 17th. One of those executive orders also restricts the number of folks that can be gathered to no more than 50. Of course, the big question mark is, what is not in those executive orders? And that is where, from this governor for a month and a half, essentially resisted implementing any changes after he let that stay-at-home order expire on May 15th and allowed businesses and retail and restaurants to reopen. And essentially, you've seen mostly life is back to normal here across the state. And that's what led to finally, with a surge in cases, nearly 4,000 a day, as well as record number of hospitalizations and ICU beds in use and ventilators in use. It led to this action, culminated into this action by the governor last night.
Vaughn, there are restrictions statewide, but no new stay-at-home order. I know you pressed the governor on this one. What did he tell you?
Exactly. I mean, as you're seeing these numbers skyrocket, a near doubling of hospitalizations in just the last 2 weeks. Again, nearly doubling of hospitalizations. You see this cart just running away. And that's where I asked the governor the very specific question, why not re-implement a stay-at-home order and essentially shut down this state again? Take a listen to part of that conversation.
I'm confident, and I think Arizonans are smart and have common sense and will demonstrate responsibility.
Could it be on the table next week, a stay-at-home order?
I said I wake up every day, Vaughn, and there is an additional set of problems, and we solve them in their turn. So the humility of this is to not guess or speculate, but to prepare.
You know, when we talk about humility, we got to roll it back a little ways, because it was back in March and April when there was that stay-at-home order in place. And during that time period, you know, it was the serious nature of justifying what it would take to reopen business. And that took under the White House Coronavirus Task Force's guidelines, saying that there had to be a downward trajectory over the course of 2 weeks in influenza-like cases and the percentage of percent positive cases and hospitalizations. But we're far past that. I mean, we're nowhere close to even meeting those phase 1 requirements yet. Still so much of the state is open, you know. Retail and restaurants are still open. Malls are still open. There's big question marks here over this 4th of July weekend. To what extent will there actually be enforcement of folks in those 50 groups or more? There's some cities that still have fireworks shows planned. This is the issue in frankly, the crisis that Arizona and consequently its hospital and on the medical side of things is suddenly facing.
Vaughn, I also want to ask you about a coronavirus reporting error in Arizona. What happened there?
This is the tough part of testing and processing. Yesterday, there was a significant fewer number of cases that were initially reported, and that's because Sonora Quest Laboratories, which processes about 80% of the state's tests, there was a digital error within the system of getting those numbers in. So that's why initially through the day yesterday, you saw such a fewer number. And now that plays into a conversation that you and I had from the Sonora Quest Labs just yesterday, as the amount of testing is suddenly the demand for testing is so substantial, and the demand for getting those tests processed, this is only becoming more difficult. The strain is becoming more difficult on these laboratories, but as well as the state in reporting this data and our ability to get out to the public the severity of what's at hand.
Vaughn Hilliard in Phoenix, Arizona. I know you'll keep asking the tough questions and keep pressing for answers. Thank you so much.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.